Each year, 1 in 5 adults will develop a mental illness. 1 in 20 live with very serious mental disorders such as schizophrenia. According to Mayo Clinic, around half of adults will develop a mental illness at some point in their life. It's also important to note that many serious mental illnesses do not surface until one's mid-20s. Other less threatening mental illnesses can develop at any time in a person's life. Considering those statistics, I think you would all agree that it is important to be well informed on the subject. This is what I'm here to do today. Mental illnesses is very common and can impact one's thinking, mood, ability to socialize, and just plain function. Because no two people think exactly the same, mental illnesses affect everyone differently, even among those with the exact same diagnosis. There is no single cause of mental illness. The National Allegiance of Mental Illness suggests that the cause is usually a mixture of genetics, environmental aspects, and lifestyles. Certain situations such as stressful work life, traumatic experience, having a blood relative with a mental illness, use of illegal drugs, or having few friends are thought to increase one's risk of developing a mental illness. Although signs and symptoms differ according to each illness, there are many that are common indicators that a person could be suffering from a mental illness. Such symptoms include feeling sad, confused, or excessively worried, as well as extreme mood fluctuations, distancing oneself from friends and family, fatigue, detachment from reality, change in eating habits, and alcohol or drug abuse. It is important for anyone with any of these symptoms to set up a visit with your family doctor. Mental illnesses can be dangerous and should not be ignored. To determine a diagnosis, one may be subject to physical exam just to rule out any possibility of physical problems that could cause your symptoms, says Mayo Clinic. Lab tests to check thyroid functions and test for drug or alcohol in one's systems are also likely. Finally, an extensive psychological evaluation should be performed. This is likely to entail describing symptoms in detail to a doctor and filling out a questionnaire. According to Curiosity.com, the top 3 most commonly diagnosed mental illnesses are mood disorders, personality disorders, and eating disorders. These are the 3 that I will talk in more depth to today. Mood disorders are most commonly diagnosed of all and affect close to 21 million people in the United States. Mood disorders commonly include major depressive disorder, dysthymic disorder, and bipolar disorder. By far the most common of these is depression. NIMH statistics suggest that it's a leading cause of disability for people between ages 15 and 44. It also tends to be more prevalent in women than men. Depression is very serious for those involved, but is usually fairly easy treatable with modern medicine. Dozens of drugs exist to combat clinical depression. Among these are Cymbalta, Lexapro, Wellbutrin, Pamelor, Nardil, and more. Also, mood disorders, dynamic disorders, and dysmia is another state of depression, but its symptoms are usually less severe than major depressive disorders. Around 3 million individuals in the U.S. are affected. The final mood disorder is bipolar disorder, affecting 6 million people in the U.S. It is characterized by major mood swings, energy, and ability to function. Similar to other mood disorders, medication and counseling are common therapies for this disorder. The second most common diagnosed mental illness is personality disorders. These include antisocial personality disorders, avoidant personality disorders, and borderline personality disorders. Nearly 9% of the population struggles with some form of personality disorder. Antisocial disorder is characterized by people's unwillingness to follow social or cultural norms. People suffering from this illness usually don't distinguish between right and wrong and feel very little remorse. This disorder can be extremely difficult to treat because those with it commonly do not feel they require treatment. Avoidant personality disorder affects more than 5% of the population, and symptoms commonly include feeling shy, inadequate, and sensitive. It is usually treated with a medication called Prozac. Similar to mood disorders, it is easily treated with antidepressants or anti-anxiety meds. Another personality disorder is borderline personality disorder. Those with this type of mental illness are emotionally unstable and very impulsive. They struggle to develop or carry on healthy relationships. This is one type of mental illness that is commonly prevalent at birth, but is not usually diagnosed until later childhood. A mixture of therapy and drugs are used to combat symptoms. The third most common mental illness are eating disorders. Eating disorders are separated into 3 primary categories: anorexia, bulimia, and binge eating. According to the NIMH, women are at least 3 times as likely to fall victim. Unlike other mental disorders I've discussed, eating disorders are not easily treated with medication. To start, anorexia is characterized as a condition of being significantly underweight. Those suffering from anorexia usually obsess over losing weight and resort to starving oneself or exercising way too often. This is a very serious illness and usually leads to hospitalization due to being severely malnourished. In the long run, therapy or antidepressants is usually recommended to prevent a relapse. With bulimia, another eating disorder, sufferers eat to soothe their hunger but purge their bodies for their food before the proper nutrients can be absorbed. Like with anorexia, patients with bulimia become malnourished and this can lead to life-threatening health problems. The last eating disorder is binge eating disorder. This is basically the opposite of the other 2 disorders, and it's classified by eating large quantities of food, resulting in excessive weight gain. Stopping oneself from overeating is nearly impossible with this illness unless treatment occurs. Talk therapy, medication play a crucial role in treatment. Sometimes people with this illness are put on antidepressants to help lose weight, as it's a common symptom. Just losing a small percentage of body weight can be enough to trigger a lifestyle change for someone with a binge eating disorder. In conclusion, there are many types of mental illnesses with different levels of severity, but they can be very dangerous and difficult to live with. It is important to be educated about such illnesses as they are common among our population. For those suffering from a mental illness, don't give up hope. There are many treatment options available and coping methods exist for after diagnosis. I hope you all learned some valuable information and are now able to understand those who suffer from these illnesses. Thanks for listening.